Hi, my name's Toby Mountjoy, and this is the Autism Show. Last episode, we talked to lots of parents about what they were thinking when they were observing their children and their worries and concerns of their first signs of when they noticed their children might be a little bit different. In this episode, I thought it would be really interesting for us to explore more, talking to a very famous diagnostician, somebody who knows the assessment process inside out. So I chose my good friend, Dr. Freeman, to join us today. She's going to share a professional view of what are those first signs, what do people in general first notice, what are some things that families will start to see with very young children that may futurely be diagnosed with autism. So hi, BJ, how are you?
Hi, how are you? Good.
So it's great you can join us today. We wanted to start by asking you some questions. Often parents tell us that they are aware that maybe there may be some things with their children when they're quite young, and mums or dads become worried, which is why they go to seek assistance. What are some of those things that you hear or notice that parents see in their children at a very young age? What do they become worried about?
The first question I ask parents in a diagnostic interview is, when did you first become concerned? Not when someone made a diagnosis or you talked to the pediatrician, but when did you first notice something? And most of the time, parents have noticed something in the first year. The most common referral, of course, is because language is not developing. As people have become much more aware of autism now, parents are also much keener and are aware of the autism diagnosis as well. All right. And that's a good thing, because we're seeing the kids very, very young. All right. And the diagnosis is pretty reliable after, I think, about 18 months. And what you should be looking for is the child developing language. And not so much words, but are they communicating with you? Because autism is a social communication learning disability. So you're looking to see for communication. Babies, when they come home from the hospital, have 4 distinct cries. Tell parents when they're upset, happy, hungry, and wet. And those are differential cries that infants have immediately. And oftentimes parents will say, well, he was a really good baby. I never knew when he was hungry. Things like that. The second area where you start to really see problems is socially, in that children by 4, 5, 6 months are playing baby games like peekaboo, patty cake. And the question becomes, not does the child play those games, but does the child initiate those games? And what you see early on in that first year is problems that remain throughout life for people on the autism spectrum. They have difficulty with communication, and they have difficulty initiating activities, particularly social activities. And you start to see it really early. One of the things that's hindered early diagnosis is that initially, to make a diagnosis, the focus was on the repetitive behaviors that children might have. And so those behaviors don't appear until between 2 and 3. And so a lot of times the kids that you see at 18 months won't have any repetitive behaviors like flapping or lining things up. Now that we've really changed the way we diagnose children, and we're looking at it more as a social communication disorder, and these kids, by the way, have some repetitive behaviors sometimes, the diagnosis is easier to make. Because in the past, you had to wait till the child started flapping or spinning or doing those things. And we don't now, because we know that those are not the most important diagnostic indicators for autism. More recently, closer to 1.5 now, or 2, and it's clear he's got it. The repetitive behavior started. You could just almost, with this little boy, see the social difficulties arising. He would engage, but there were times when he would not engage with people. So you're looking to see if the children are engaging. When I see a really young child and they're just wandering around non-directed, going from thing to thing, they're usually on the spectrum. And again, if you think about that for long term, that's the lack of executive functioning skills developing. Because executive functioning skills allow us to organize, predict, and problem solve. But a lot of times, even 2-year-olds don't do that at the level you would expect them to do it. So that they're really just wandering around, not engaged.
Another question I have for you is, how do we differentiate between like autism and developmental delay?
Well, the most important step in making a diagnosis, and this is where people make the mistake, is you have to have a developmental history. You have to know how that child is developing over time. And in typical development, children learn to walk, they learn to talk, and they learn to interact with you. By the end of the first year, you have a little person on your hands. Children who are just delayed develop all of those skills, but develop them at a slower pace and maybe not at the same level. Kids on the autism spectrum are up and down, up and down. So they may start to walk and stop. They may start to talk and stop. They may say a word and then you never hear it again.
Well, BJ, thank you so much for your time today. That's such an informative amount of information for our audience. I think it's been brilliant to hear your perspective and wisdom on this subject. Thank you for watching.